Would you recommend that couples who are struggling to conceive try ovulation kits or ovulation testing?
Oh, this is a very interesting question. Everybody always wants to know, when am I ovulating? Let's save it up and only have intercourse when we know that we're going to ovulate. And this is really, in an ironic sense, a good way to practice birth control. I'll explain to you why. The ovulation kits are very inaccurate. It's about a $3 billion a year industry, and they're very, very inaccurate. And your egg is only good for about 8 hours after you ovulate. And the sperm is good in your tract for 3 days. So you always want to have sperm present whenever you ovulate. One reason IVF works so well, no matter what the infertility problem is, we're getting the egg right then and there, we're fertilizing it with the sperm right then and there, and we don't have to worry that we're mistiming. So even with IUI, which is very popular, it's really easy to mistime it because the egg is only good for 8 hours after ovulation. So frankly, and the husbands all love this when I give this advice, if you're going to try to get pregnant, certainly for the next year before you go to IVF, say if they're a younger couple, have as much sex as you can. Now, the average in humans, the average tends to be 2 or 3 times a week. That seems to be what couples are inclined to. Many will have sex every day or twice a day, and many will have sex once a week. But the human average is about every 2 or 3 days. Now, that fits perfectly with the ideal fertility timing, because that way there'll always be some sperm around when the woman ovulates. So I have a rather nihilist view about this based on over 50 years of experience. And that is, if you're trying to get pregnant naturally, don't try to time it. Just have a lot of sex. The husbands always want me to write that down on a prescription pad. But that's my advice in terms of ovulation timing.